Hi everyone, welcome to episode 15. My name is Isabel and today I'm going to introduce Celeste, who is going to talk about the tongue. She is going to talk about what is the tongue and what it does, the tongue as an indicator of wellness, conditions that affect tongue function, fun facts about the tongue, and things that we can do to keep our tongue in optimal function. Okay, so go ahead, Celeste.
Thanks, Isabel. Hi, Sue.
Hello.
There in the background. So, the amazing tongue. So, I'll kick off with a definition. The tongue is a mobile muscular organ that's covered in mucous membrane. It consists of 8 muscles, interestingly, and a lot of those are actually the muscles that anchor it to the floor of the mouth and the jaw. And so they help it to change shape, to flatten out, to curl up, and to move food around our mouth and mix the saliva in so that we can actually taste our food and so that we can form it into a bolus that we can swallow. So, it's the function of being able to move food around to form a bolus we can swallow and then communicate. So it's essential. We can't speak without a fully functioning tongue with all the muscles and nerves that are intact. So, if our tongue's not working at its best, often it'll be evident as a change in our speech. So, in fact, the tongue's the only muscle in the body that's not supported by the skeleton, like by the bones. It just works on its own. It's pretty amazing. We can do all kinds of things with our tongue. We curl it up, poke it out. And some of us find it really hard. It's always a bit of a trick when we were kids to see if you could, make your tongue into a bit of a curl. And some people have troubles with that one. I can't roll my R's, but Isabel, you've been expert at that.
Yes, that's right.
I envy you. And, you can do a really good haka without being able to poke your tongue out properly. So our tongue can be an indicator of broader health issues. And in fact, in traditional Chinese medicine, a full tongue assessment is like part of a broader assessment of your overall health and well-being. So they'll look at the colour, look at what the taste buds are looking like, and the shape and texture of the tongue. So as far as colour goes, if we have, our tongue should normally be pink with a bit of a thin white coating on it. It should be nice and moist. And if it's very pale, that could be an indicator of anemia, for example. But, really, our tongue can go all colours of the rainbow, and it's not always because we've been eating super-duper ice blocks. Certainly foods can change the taste of the colour of our tongues, obviously, but there's certain conditions that can do that as well. And a lot of them are benign. And often they're associated with poor oral hygiene, and so can simply be rectified with that. But, very red inflamed tongue could be an indication of a celiac disease.
Which is actually quite common. It's increasing in its commonness. In society today, we've got a lot more people suffering with celiac disease and intolerances in their diet.
Yeah, that's right. And, there's so many other effects with celiac disease, not just a wheat intolerance. It affects all of our absorption of nutrients and, it's quite an immune system compromising process. Yeah, so like I was saying, most of these discolorations are benign, but, if you switch up the oral hygiene for a week or two, and then if it's still doing that, still the green colour or yellow colour or whatever, then perhaps go see your doc and just get it checked out. It's things like a white film on the tongue that's patchy, could be like a thrush or candida infection. And we see that quite a bit in hospital, don't we, guys?
Yeah, well, I remember, working in intensive care, because a lot of your patients are immunosuppressed and quite sick. And so, they would get a lot of those things. And the tongue actually swells in the mouth with candida as well. And so sometimes when, particularly in older person's care, if patients were struggling to speak, sometimes we'd be jumping to thinking they'd had a stroke, when sometimes we just needed to have a look in their mouth and just check what their tongue was doing. And then you'd see the big white furry tongue. And, you would be like, okay, let's get the doctor to have a look at this, because you knew that it was, candida albicans had popped in to visit, and you needed to get on top of their thrush, basically.
Isabel, in ICU, we have really extensive protocols for mouth care.
Well, yes, we do have extensive protocols. It is something that you have to do regularly, cleaning the mouth and using special solutions that we use in ICU. I remember, the last ICU I worked at, you have to clean the mouth. The patients who were ventilated, you have to clean the mouth every 2 hours. So it's a very frequent and regular scheme, just to prevent, the consequences, because that can also, produce not only in the tongue and the mouth, that can cause infections down, the throat, or, down other areas of the body.
Can I just add to that, interestingly enough, working in the palliative care sphere that I have for a few years, because, people who are coming up to end of life care, they need regular mouth cares because they don't have that. They're not really eating and drinking anymore, and they don't have that capacity for safe swallow and those sorts of things. So you have to do a lot of mouth care regularly with that. And beautifully, there is some, because people are quite debilitated at end of life in many cases, some of the care, because we're at that end point of care and we're trying to make people happy and comfortable, sometimes if a client, for instance, had a really nice penchant for a red wine, they're a red wine drinker or whiskey drinker, sometimes we would finish off mouth cares with just a bit of a whiskey swab, only because that used to make them smile. I mean,
yeah. Well, it's one of the simple pleasures.
Yes. And you could see their eyes just twitch a bit because they could taste it on the swab and they would just smile. So I don't know, that was just a beautiful sort of end of life care that is mouth care, but doing it to the client's needs and wishes.
Yeah, that's great, Sue. Yeah, so just to recap, I didn't cover all of the possibilities, and I won't, but there's some big ones that can affect the colour of our tongue. So some medications can do that. And it can be indicative of nutrient deficiencies, which is another reason, like our anemia, it's not enough iron in the diet. So that's why it's good to go see the doc. Tobacco use, of course, whether you're chewing it or smoking it, will always affect the tongue and our taste and the colour of the tongue. And that were the highlights, really. So moving on to our next slide, the disorders that affect the tongue. Now, there's a few, and I've broadly grouped them into one that's a congenital, burning mouth syndrome, sores and bumps, altered taste, and progressive neurological conditions. So ankylosing, which we commonly know as tongue tie, it occurs in 1 in 10,000 roughly births, so it's quite rare. But for these babies, often we pick up that there's something not right when they're having trouble latching to suck. And so they're really having trouble feeding and they're getting pretty upset because they're hungry. And so that's where we pick it up, and something can be done to address it. Sometimes it's they get through that stage and it's picked up later on when kids are at school, but they're actually having speech difficulties and saying their words properly and being understood. So that's another option where it gets picked up, and it can usually be addressed with a surgical procedure to release that tie. So what it involves is just that the little piece of tissue that anchors the bottom of the tongue to the floor of the mouth is really short and a bit tight. So it means that it's hard to poke the tongue out properly, and when they attempt to poke their tongue out, often it looks like a little heart shape. And so there's another sign, but it can very easily be attended to, and speech therapy works a lot in this area to help these people. Another one is burning mouth syndrome. I'd never heard of this, so this is interesting to me. So apparently it's characterised by a tingling, burning or numbing sensation with a dry mouth and an altered taste. So there's no visible abnormality in the mouth with this. It's just this sensation. Apparently there's a higher incidence in postmenopausal women, and it's thought to be an abnormality of nerves or the nerves that sense pain and taste. So measures that can help keep the mouth moist, like lozenges and sips of water and gum, can help to give some relief. But a doctor can do an evaluation to see what else might be contributing to it, and so that they can identify what could be addressed to give relief and give other measures. Have you guys heard of that one?
No, I was going to say, how do you just notice it intermittently, or is it pretty much all the time, or what is that about?
Yeah, so it wasn't stated in the article that I read, but yeah, I would imagine it could be intermittent, not necessarily all the time.
Yeah.
And particularly if it's with menopause, perhaps it's, to do with hormone levels and stuff interfering with those nerves. I don't know.
Yeah, it's just interesting. Have you ever known anyone with that?
No.
But I guess it might be something you don't, because it's uncommon. You might not notice it or just think that's something that's what happens to you. I don't know. That's really a new one, isn't it?
It could be one that people just put up with.
For sure. I don't know. That's really
interesting.
Rack
it up to age or something like that and just get on with things.
Yeah.
Interesting. So sores and bumps. Now, there's a range of things that can cause minor trauma to the tongue, anything from just biting your tongue. And you know how it is. You bite your tongue and then it swells up a bit and then you just keep biting it. And it's so excruciating. But the good thing about the tongue is that it heals very quickly. Like our taste buds are there's 10,000 taste buds or something on our tongue, and they actually renew every week. So it's amazing how quickly it heals up. But little things like some of the foods we eat, like have you guys ever had pineapple and you've got one of those little prickles or whatever, or it's the acid in the pineapple that makes your tongue really tingly?
Yes.
Yeah, so that's one. And then mouth ulcers. And so anyone that wears braces or, a device to sleep at night or whatever can maybe get some rubs, or even dentures can cause those little ulcerations in the mouth. And usually that's simply treated with a bit of an anaesthetic or antiseptic anaesthetic solution like SM33, and they go away after a couple of days, don't they?
Yeah, except with the orthodontic things, like they have to, what's that? It's a gum that you put on the inside where it's rubbing on the lip or wherever.
Yeah, and the wax.
Yeah, the wax that they give you to put on the mouth and stuff like that. So, yes, kids are always walking around with a box of wax in their pocket to keep their mouths protected until they can get back to the orthodontist to get the ties turned off so that, whatever's sticking in their mouth can stop it.
Yeah, that's it. So that usually they heal up quite quickly, and even some of the big lacs, like in ED, I've seen some pretty big lacerations to people's tongues, but they rarely suture them because the tongue's such a slippery sucker to hang on to try and put stitches in it anyway. And can you imagine trying to get someone to keep still? You just about have to give them a general anaesthetic to put stitches in it and protect their airway at the same time. So generally they heal up quite well anyway.
You as well, who've had tongue cancers, and so they've had to have a general anaesthetic and have sections of their tongue removed because of cancer. So that's where if you do have those issues where you have had an ulceration and it just hasn't healed, just I guess be confident to know that that's actually unusual for the tongue, because it will heal really quickly normally as a rule. So if you've got something that keeps going on for longer than a week, that's unusual, isn't it?
Yeah, that's it, Sue. It's exactly where I was heading, actually.
Oh, sorry.
No. It's a good segue. So, just like the rest of our skin, we're always told, to to monitor your skin, and if you see a change and it doesn't go away, then you should get it checked out. And it's just the same with the mouth, the tongue, and all of the mucosa of the mouth. So any wound that doesn't heal, and particularly if it's hard and painless, it could be an indication of an oral cancer, and it's best to get it checked out. And if it is something, well, you can get on the track to getting it sorted out. Most commonly, oral cancers occur on the sides of the tongue and the floor of the mouth, and sometimes sort of the back of the throat. And interestingly, here's another little tidbit that I picked up from my research, is that sometimes the primary chancre of syphilis occurs in the mouth, and when it does, it's not actually picked up. And so these people can often progress to second or third stage of syphilis before that it's actually recognised what they have, because it is painless, it's hard. They just put it down to being something else, and it's just not on their radar. So yeah, anything that's not healing, it's best to get it checked out.
Mm.
And syphilis is something that waxes and wanes, and it has been on the increase in Queensland, and Victoria has also had a bit of an increase in cases as well in more recent years. So it's something that we should ignore at our peril, especially as health professionals. So the next thing is altered taste. So smoking, of course, reduces our sense of taste. I've had an uncle who I remember he would always put Vegemite and honey on toast, and I thought, oh my goodness, what a combination. Maybe, and lots of it. And I sort of deduced that it must be to do with his taste buds being a bit screwed up from quite a hefty smoking habit.
What sort of smoking habit did he have? Was he the old school who had the unfiltered Camels and Marlboros that,
Look, I don't remember that. No, my other uncle did that had a pretty good habit, and he kicked it too. But no, this was, I think it's cigarettes.
Yeah, I just used to find the smoking habits of some of the older people I grew up with, like just going, wow, how did you do that? Like that was harsh gear that you're sucking in. But anyway, that's just a segue.
Yeah. And of course it's one of our risk factors for the oral cancers as well. But diabetics can also suffer from reduced saliva production and an altered sense of taste. So, our taste buds need saliva to do their job. So if anything that's affecting this flow of saliva in the mouth is going to affect our sense of taste. But with our diabetic patients, they feel that it's probably due to either slower renewal of those taste buds because, when we have diabetes, our whole healing and immune system is a bit slower to do its job from the high levels of sugar in our blood. And it could also be to do with the nerves that supply that area and doing the sensing for the tasting due to the neuropathy and degradation of nerves from diabetes. Interesting though, the diabetic guidelines are changing. There's more and more coming out about the dangers of ultra-processed foods and how we can, like the real foods to be eating and things like therapeutic carbohydrate restriction and so forth is actually being acknowledged now as part of how we can help to manage diabetes. So I'm really heartened that they're getting on board with that now because it definitely makes a difference. A lot of people are able to reverse their type 2 diabetes if they can get on track with getting rid of the processed food and the sugar and processed flour and stuff. So back on track, the final area was progressive neurological conditions. So things like ALS and multiple sclerosis and even some strokes, not that they're not in the same class, but they do affect the nerves that innervate the tongue. And so that affects the ability to swallow. So with our ALS and MS patients, there's just a slow degradation of the signals getting to those muscles and weakening of the muscles. And over time, they're not able to do their job. So they lose the ability to swallow and they lose the ability to speak effectively as well. So there's a lot of work happening in that space to support these people because that would be a massive adjustment to have to deal with, and it would affect you in a lot of ways, and your identity, and just to communicate your needs to people. And food being a simple pleasure of life. I mean, yes, we can put a tube down your nose, but yeah, it kind of takes the fun out of it, doesn't it?
Well, just from my personal experience of having a loved one who has a neuromuscular degenerative disease, you know, I know he, it's, you have to be super mindful of when you're eating in front of people because, you know, you are a high risk of choking. So you have to be super mindful, chew a lot, slow down. And, you know, and so for him, as well as that, you know, what you were saying about the studies they're doing, you know, his monthly immunotherapy is vital to, you know, him feel, you know, the degeneration has slowed with that sort of treatment, and you know, he it's better. So as long as it's working and it's slowing that process down, it is better. But it is really hard when those things that we take for granted, like swallowing, they start to fail. It's really hard.
Yeah, and I mean, I think it's great that we've got such evolved speech therapy and occupational therapy options in this space. So they do so much to give quality of life and extend that quality of life for people that suffer from these conditions.
Definitely.
I didn't mention angioedema, but that is one that's a swelling of the tongue and swelling of the face and the hives and so forth that happens with an allergic reaction. And that can incorporate the tongue as well, because all the lips and the mucosa of the mouth can swell, and it can include the tongue as well. So, but I'm not going to go into all the treatment for that in this particular presentation.
Anaphylaxis is one for a whole other day.
Yeah, exactly. It's a subject on its own. So moving along, I'm going to talk about some fun facts about the tongue. Sue's got me onto the fun facts. I think it's great. So a couple I've already mentioned, but one I've learned is that the tongue each of us has a really unique tongue, and that it can be the pattern of taste buds and so forth is like fingerprints, like we can be identified by our tongue.
Do they fingerprint? Do you fingerprint your tongue and take pictures of it? I don't know.
I get people to poke their tongue out when they do the mug shots. Anyway, so the tongue, actually, taste buds don't just live on the tongue. So taste buds can actually be on the inside of our cheeks. They can be on the lips, and they can be in the roof of the mouth, and even under the tongue. So I thought that was interesting. Our tongue is incapable of tasting if it's dry. So yes, as I was saying before, we need saliva. Otherwise, it's just not going to do that job very well. And the other interesting thing I discovered is that if you're in Tibet and someone pokes their tongue out at you, they're actually being friendly. It's not considered to be rude, and it evolved its thought from an order of monks back in about the 9th century, and apparently there was this really evil king who had a black tongue. He must have had a black heart as well, and so the signal that you had nothing to do genetically with this king was to poke your tongue out, and so like, I come in peace. And I actually corroborated this with a friend of mine who's from Nepal, and he said, yes, there's because they have a number of different indigenous tribes in Nepal, and it was from one of these tribes that they still do that. So, little fun fact. And so just to wrap up, tips to look after our amazing tongues. So I took these from the American Dental Association because they just laid them out so nicely, but they're very much the same for the Australian Dental Association too. So it's brushing your teeth at least twice a day with toothpaste that contains fluoride, eating a healthful diet that's low in sugar, cleaning between the teeth every day, so like getting the floss out or the little pixters, Visiting your dentist at least once a year, twice, like every 6 months for a checkup is even better. And they do really thorough checkup of your tongue and everything too, I've noticed.
Yeah, well, that's where most oral cancers get picked up, is with the dentist, because it's the dentist who often notices the variants, and they sort of get that person to then go on to their doctors.
Yes, yep. So avoiding the tongue or lip piercings is not a good idea, and it does affect our teeth, doesn't it? Like actually causing erosions, and avoiding tobacco products. And for anyone who's hooked on tobacco or been hooked on tobacco, we all know that that is not just a simple thing to do, but more power to you if you can. And there you have it for the tongue. Thanks, everyone.
Awesomeness. Well, thank you, Celeste, for that interesting journey into the tongue. And we hope you've enjoyed that today. And if you'd like to share this, follow us, and keep watching what we're up to on our podcast, that would be great. Also, you can give us feedback through YouTube, or even go on to our Facebook page and follow us there, and reply back to us and let us know what content you'd like us to focus on, because we are on the head to toe journey of healthcare, and we're picking topics that are interesting to us. But what if they're interesting to you? Let us know, drop us a line. Thanks, everyone. Have a great day.
Bye.
Bye.